Fine inside. All right, again, and thanks. Well, talking medicine this morning, as we do always on Thursdays on Fox Wilmington here on Carolina in the Morning. This morning, Dr. Philip Brown with New Hanover Regional Medical Center, Chief Physician Assistant. They're also thoracic surgeon. Do I have that correct?
I'm a vascular surgeon by trade, yes,
okay,
sir.
and we're talking about something that I admitted to the doctor I had never heard of before, abdominal aortic aneurysm. You say you can also kind of refer to it as AAA. And it's bad that I haven't heard of this because you said that 14th leading cause of death?
Yes, it's the 14th leading cause of death in the country, and actually 13th leading cause of death in men in the country. About 200,000 aneurysms are picked up on screenings annually, and of those, about 15,000 or so are large enough to carry a risk of rupture and death for the patients that have them. And
in reading the information that you provided, if you suffer one of these, it's really not in your favor.
Right. The natural history of an abdominal aortic aneurysm that ruptures is somewhere between a 75 and 85% chance of death. If you do happen to be in a hospital or make it to the hospital, your chances improve to around 50-50. Now you put that in the context of if it's detected by screening, you know you have it, it can be treated when it's approaching a dangerous size, then the chance of dying from that are well under 2%, and in the era of all the minimally invasive treatments approach 0.
And what's the screening process? Because I was talking to you off camera about it. This seems like it goes hand in hand with heart disease.
It does. The risk factors are very similar. In fact, heart disease itself really is a risk factor for it, as is hypertension, high cholesterol. There's a real strong family predisposition to these types of aneurysms. COPD or chronic lung disease can be associated with it. It's common in diabetes, and those are disease states that we really see overlap hand in glove with cardiac disease. So those are really the main things that put people at risk. Now, the screening process is simple. It starts with that process of history. If you have any of those risk factors, and as you age, it's really uncommon in people less than 55,
sure,
certainly less than 50, although in families with strong histories, you can see earlier aneurysms. So we would recommend a screening with ultrasound at about the 10 years earlier than the family member had it. But in general, if you take someone who doesn't have a strong family history of it, then what you'll need to screen for typically is patients over the age of 65.
And again, it's one of those, it's another instance where if you have any questions, you feel there's a symptom coming on, you always want to contact a doctor. This is one of those I wish we had the 5-minute segment that we could do with this. But again, a very serious thing that you would want to contact your physician with. Doctor, we appreciate the time.
It's my pleasure.
Thank you. We're back with more after this.